Welcome to your presentation for the QUALIFI Level 5 in Certificate of Aesthetics. This is the presentation for the short answer question paper for Unit AP601, the Anatomy, Physiology and Morphology of the Aging Face. So as a reminder of the SAQ marking criteria, they are just pass and fail only, and there is a minimum pass mark. This SAQ paper is out of 6 questions, each question worth 10 marks. So you have to get 39 out of 60, which is a 65% to pass. You must have a minimum of 4 for your pass mark, but obviously a 4 for all 6 questions would not give you that minimum of 39 either. Make sure that you're aware, as usual, that the marker will be taking into consideration what you write, your knowledge and understanding, how well you write it. Referencing is also something that will be looked at, but is not compulsory. And the word counts are just as a guide, but just to try and help you know roughly how much should I be writing. So we finally got to the assignment that is going to be sort of a little bit more juicy and a little bit more detailed and looking more at specifics that might be related to treatments than previous assignments. So this one is the anatomy and physiology and the morphology of the face. This unit is actually, you'll see that it is got called AP601. And the 6 represents that it's actually a level 6 assignment. So a lot of people ask, why does it go from level 7 or level 5 to level 7? This is because 6 is kind of embedded within level 5. So it's a level 6 unit. Now I understand that you would have done previous anatomy and physiology. It might have been level 3 or level 4. But remember, this is level 6. So you can't kind of think, oh great, I can copy and paste from a previous assignment and cover this. It's completely different. You can definitely reflect back on your previous knowledge and start to build on that. So you take your level 3, level 4 information and start to build it into a level 6. Also look at the title. So the title suggests it specifically and has stated face. So again, your previous anatomy and physiology might have included face and body. We just need to make sure that you keep on sort of subject and be talking about the face. So again, some other times it might have mentioned anatomy and physiology, but now we've had this added word of morphology in there. So morphology in this instance, it's the human morphology, is basically the study of the structure of the human body. And you've got to take into consideration how it develops, how it moves along its life cycle, and how its sort of activity can change within this aging process. So you've got to build on this knowledge and not just take the basics. So hopefully that makes sense, and you can start to sort of take your level of knowledge up towards our level 7 that we're hopefully working towards. So question 1 of 6. So again, we've not got that many questions on this particular short answer question paper. And again, we're going with a similar format that we've done before. So we're analysing, we're looking at sort of influencing factors, we're working out the consequences of positive and negative experiences as well. And as we've said before, make sure you try and link into the sort of your own practice and your own knowledge. So this time we're looking at analysing the structure and functions of the skin and its appendages. So the marking criteria for this question and for the questions moving forward, as you know by now, you can see that your mark is out of 10. 0 to 3, the first box is inadequate and not enough to pass. Then your first box is out of 4 and 5, which is very basic information. And as previously stated, getting basic information on all of them will also be a fail. You've got your 6 to 7, so the middle of the road, and then we've got our higher marks. And within this, you'll notice how in both this middle section and the other section, you've got to link it to aesthetic practice. So how can I link it to aesthetic practice? It's anatomy and physiology, but you can still put it in with things like highlighting how the epidermis is an area that we treat, and this is obviously very specific to like chemical peels and working on different layers of the skin, whether it's a superficial or a medium peel. You can talk about as well, highlighting the dermis is the area where you'll get that regeneration from microneedling. And also when you've got the functions of the skin, how you can talk about that wound healing cycle and how that irritation from chemical peels and microneedling are part of that end point. You can also mention about the acid mantle with the functions of the skin and the pH and how it links to the aesthetic practice of prepping the skin for peels. So you can do generalized links, but think about you'll be discussing this in a lot more detail with pH and that in the next SAQ. So don't go off in too much of a detail, but just put a generalized comment so that you can start to just link to aesthetic practice. You don't have to do too much detail. So things to think about mentioning, you can obviously be talking about the layers of the epidermis, so our stratum layers. You can be looking at the two different layers of the dermis, so our papillary layer and the reticular layer and their function and how it links back, as I said, to the aesthetic practice. Your appendages of the skin, what are they and how sort of they can affect the sort of functionings of the skin as well. And just make sure your answer reflects that level 6 criteria. So again, you might have lots of previous assignment stuff you can look back on, but remember that would have been at a lower level. So make sure you find some studies and your sort of research is linked to sort of your referencing as well. So you will find lots of information on anatomy and physiology, but as with previous work, you know you've got to use reliable websites and ideally maybe even find them that have a link to aesthetic sources as well. I've always used Google Scholar over Google because it gives me research papers and it gives me more reliable resources. Your textbooks you can find, sort of dust them off from your level 3, but remember that they're going to be very basic. So Google Scholar, I always find if you just type in Google Scholar, it will bring it up. You can type in whatever you want and your key point, and it will bring up medical journals. Not all of them can be accessed without paying, but you just click through until you find the free ones that can help with you. I've done many higher course and I have not bought a textbook in years. I've always used Google Scholar. So as you can see, we started with skin and now we're going in deeper. So question 2, it's starting to again use that familiar structure of using an analysis to look at the structure of the bones of the head and neck and their function. So again, on level 3, you might have talked about the position where they are, what they might protect, what joint they might have had, like a hinge joint in our mandible. But we're going to be expanding on that knowledge as well. And remember, linking it into that morphology. And again, your reminder, if you look at your marking criteria, if you miss off linking it to aesthetic practice, you can still get sort of the pass mark or even slightly a little bit higher, but you can't get a mark higher than 7 out of 10. So if you want those higher marks and start pushing that knowledge, linking it to the aesthetic practice. So it's not a fail if you don't do it, but you might just kick yourself by not putting in a couple of sentences and obtaining a higher mark. So again, linking to aesthetic practice with the aging and the bones, you've got to always remind yourself what's the question is asking me so you don't fall down that rabbit hole. You can obviously mention how bone density can start to weaken as we age, and even studies I found that can happen from 35. You can talk about the specific bones around the eyes and on the face and the cheeks and linking back to a medical study. You can also mention, to link to aesthetic practice, how you can add dermal filler to replace the bone that has been lost or to support the loss. So I found this within a medical paper from Google Scholar. So it took me all of 5 minutes to find this. But what you can see here is where they've took an image, so not quite an X-ray, but a different version of an image, where you've got in picture A, you've got someone who is what they're classing as a younger female. So you can see the bone density, how much brighter it is here. You can see a lot more of the jaw, and sort of the positioning is more as a usual skeleton as you would see it on a diagram. Then if we go over to B, you can see that there is a difference in the shape that's occurring. So you can see not so white in the bone density, and how the jawline isn't as visible because it has changed its position and obviously lost some of its density. So this was a study that I found, again on a simple Google search. It's also, I've got sort of the reference here to it, but I literally just typed in on a Google search bone density morphology aging, and these are one of the ones that came up. So you can see how you can then link to something, and this was on an aesthetic surgery sort of research. So again, it's combining the two together. Again, another extract that was easily accessed, where it's talking about the bone density within the orbit of the eye. So again, we can see in a younger female here, the eye socket, in comparison to an older female. They didn't have ages on this one, but you can see how here that eye widening's happening, which will affect your zygomatic bone as well, which is your cheekbone. And again, this picture underneath, you can see where we've got that widening happening. And so this last picture is where they've put dermal filler in to kind of replace what has been lost. So an easy link to the aesthetic practice as well. And here is a different study as well. Again, this is looking at the mandible, the jawbone, how you can actually see in sort of our younger female, we've got that sort of, again, typical angle of what we expect to see on a diagram. And then you can see in an older female here how it's literally the angle of the jaw has changed. You've lost this bone density, so it's a lot more forward. The chin is even a lot more pointy, and you can see the maxilla, the upper jaw as well, how it's sloped more forward. So again, this is what's meant by the morphology of the face. So basically, to conclude, as we get older, as part of the aging process, the bone minerals and the density will also decrease. And that will happen throughout the body, but remember, we're trying to link it specifically to the aging on the face and link into aesthetics. So again, you can start to sort of talk about decreasing in other things in other questions, but remember, this question was specifically asking you about that bone structure and bone density. So as you go through your assignment, remember this is asking you specifically about bones, and it's asking you specifically for sort of face and neck. So there's no need to start discussing other bones of the body. Don't go off on a tangent and waste your time on talking about something that's irrelevant. Make sure you're constantly linking it back to that aging process, and again, link to the aesthetic practice to gain those higher marks. So we're on question 3, so halfway mark. Question 3 is again working on this analysis. So again, a very common command verb that we're doing, that you're starting to sort of make an analysis. You're finding all your information out and you're coming to a conclusion from what you found. This time we're sort of doing an analysis on the functioning of the muscles. So we've done skin, we've done bones, now we're on muscles. So we're analysing the functioning of the muscles that are responsible for facial expression. So facial movements, looking at the sort of worry lines and nose to mouth lines and the lines that occur when we pull a facial movement. So the marking criteria, again, don't make a mistake of just not linking it to your aesthetic practice. But on this one, it's not reliant on you as linking it for sort of the middle of the road as well as the top ones. So we've got here, if you just outline the functioning of the muscles that are responsible for facial expression. So that's kind of like your level 3 basics, where you'd sort of put where the muscle is and what action it does. You've clearly described the function of the muscles that are responsible for facial expressions, and you've given examples. And then you take that analysis even further and start to look at why it's important to know that and the significance of this knowledge within your aesthetic practice. So again, taking part from the assignment, the muscles are responsible for contracting and making facial movements or expressions. So where they are placed, because they are quite superficial, they will pull on the skin and will cause this wrinkling of the skin. Sometimes they might just be dynamic wrinkles, so you only see them when that muscle is contracting, or obviously over time these dynamic wrinkles will become static lines. And again, I found this picture from a study on Google Scholar, where you can see someone of different ages pulling the same movement, but the difference in the skin and the sort of way it reacts around it varies depending on the age. So how can I link this to aesthetics? You can be looking at explain the difference between dynamic and static lines. What are the common lines that your clients will be wanting to have treated? So their technical names or their sort of commonly known names. Which muscles are responsible for causing those lines? So you can think like your corrugator and your procerus for causing the 11s. Your worry lines is your frontalis. You sort of can look at sort of naming some of these muscles and what can cause them with a contraction of which muscle. And then thinking about it, why should I as a practitioner have knowledge of these muscles? And I mean, it's kind of pretty obvious. If there's a wrinkle that's caused by the contraction of a muscle, if I know which muscle's causing it, then I can inject botulinum toxin into that muscle and stop that muscle from contracting. So it's that simple. But if you don't know their placement, how superficial or how deep they are, how can you inject them correctly? Like your corrugator, if you inject that too deep, you could get the eyelid muscle and cause ptosis. So it's about linking that knowledge to you as a practitioner. So now we've got a new command verb, one we've not used before. We've got differentiate. So you've got to differentiate between cranial, sensory, and motor neurons, or sorry, nerves. So what does differentiation mean, or differentiate? It's basically asking you what's the difference between cranial, sensory, and motor nerves. You've got to make sure you identify the differences and what they do in sort of comparison to the other type. So what are the differences? So cranial nerves, this is again taken from the sort of assignment. So cranial nerves means cranium being in the head. So we're linking it back to the sort of whole unit of being just for the sort of upper neck and head. Cranial nerves is what's given to 12 pairs of nerves that basically lead directly to the brain from the head, neck and trunk of the body. These will usually go through your spinal cord, as some people will know it. They then get separated into two different jobs. You've got your sensory nerves and your motor nerves. So the clue's in the name. So your sensory nerves will usually detect a sense. So think of your 5 senses: touch, pressure, pain. You've got your temperature. We're obviously as well thinking about even some of them which are doing smell, hearing, sight, taste even as well. So sensory nerves will detect these senses and then cause the body to react in a certain way. So if we're cold, our body will get the message from our sensory nerve that we're cold, so then it will activate a change in the blood vessels. So you'll get that vasoconstriction, you'll get that shivering, you'll activate the erector pili muscle to make your hair stand up on end, and it will be your motor nerves that will trigger that. So your motor nerves are the ones that are sort of doing the voluntary movement. So you'll get a message to lift your arm and you'll lift your arm. Involuntary ones are ones we don't have to think about, fortunately, like your diaphragm for breathing. So some nerves can do both, but it's thinking about sensory nerves are dealing with your sensors and motor nerves are dealing with your movement, but they do work together to sort of have that homeostasis. So again, looking at your marking criteria, you've got to think about that aesthetic practice again and looking at the significance of having this knowledge so you can be a safer and better practitioner. So you can give examples of common facial muscles, their position, and why you feel it's important you know them. And again, you can think about this is where you start looking at your higher level things. So not so much maybe microneedling and chemical peels, but you can be starting to look at your botulinum toxin, which is a neurotoxin. It's designed to affect the nerves and prevent these signals getting through to the muscles, so the motor sort of nerves won't work because they're not getting the message and therefore not causing the muscle to contract. Also, you can think about why it's important I know the position of these nerves, because they can be easily damaged, and once damaged they can be slow to recover, or sometimes not even recover fully. So it's important that you know where these nerves are, so you can avoid causing trauma to them or unnecessary trauma. So question 5, we're back on doing analysis. So question 5, we are in that familiar territory, but it changes slightly because now we're starting to look at the vascular system, and it's starting to specify about injections. So, and the importance of the relation to knowing the vascular system in relation to injecting. So again, maybe not so sort of related to the treatments that you're doing on level 5, but it's starting to develop your knowledge for the higher levels. So it's specified as well high risk areas. So we're starting to look at our injection techniques. So this is where we can start looking at vascular occlusions. Why is it important to know about them? You would go more detail with your level 7 assignment when you are on level 7, but you can obviously break it down to that the blood supply is like a transport system, and if we block a blood vessel, then we are preventing that transportation of oxygen which is needed, therefore starving the tissues, and sort of they start to die and cause necrosis. So you can see here in the example, we've got blue, which is our veins, and red, which are our arteries, which are a common sort of color classification. And we can sort of see how they come up the side of the face. And this will indicate these high risk areas that you may want to take on and discuss in your assignment. So if we start to look at the marking criteria for this question as well. So the lower grades, you've outlined the function, what is the vascular system and why is it relevant to know this information in regards to injection techniques. And you've also mentioned high risk areas. So if you forget to mention high risk areas, it will be classed as lacking information, not enough to pass. Then you can move over to your sort of middle of the road where you've clearly explained the function of the vascular system and how it's relevant for the injection technique. You've included your high risk area, and then the addition to this area is that you've summarized. So you sort of concluded the probability of injury and given sort of examples. So again, how high a risk is it? Is there more high risk areas than others? And you've sort of took it up a gear. Then you've done all of what you've done in the previous one, and you've identified in detail the risks associated with aesthetic treatment. So obviously that risk is going to be your vascular occlusion. So make sure you look at your entry sort of your marking criteria so you can start to sort of put the key information in to give yourself a better chance of getting the higher grades. So obviously the link into aesthetic practice, you can obviously be specific, and even though the level 5 isn't about dermal filler and botulinum toxin, remember this is level 6, so it's in preparation for that. So you can obviously start to talk about the aesthetic injections and dermal filler and why it's important that with to be familiar with the vascular system to reduce the risk significantly of a complication. So to round up, are there areas more risky than others? Name those areas. I mean, as the facial artery comes up the face, it actually gets more superficial, hence why we find that more cases of VOs can happen on the nose, because it's more superficial, and even to the point where filler in the 11s. So not a lot of practitioners will actually put filler into the 11s because that's an extremely high risk area. So if we know the risk is there, can we reduce it? So you can mention things like aspirating. It's not a fail-safe, but it's a way you can reduce the risk. Switching out to an air cannula if it's suitable for the area. So again, you reduce the risk. So it doesn't eliminate it completely, but it significantly reduces it. So you can talk about ways to reduce the risk, which will show a higher level of thinking. So we lead to the last question. We're back with our analysis again, and this time we're going back to the nerves, and we're analysing the actual function of these nerves, and again we're linking it now again to injection techniques and including our high risk areas. So it's taking that anatomy and physiology that you might have generalised know for level 3, 4 and started to sort of think about the specifics of why you should know this. Our marking criteria, again, if we look at this, so sort of the lower levels, you've outlined sort of the function of the nerves relevant to the injection technique. If you don't put in injection technique, it will be classed as lacking enough knowledge, and include your high risk areas. Your next one up, you've done all of what's been asked before, but you've described them with a bit more detail. You've not just named and outlined them. And you've summarised, so you've concluded the probability of injury and sort of given examples. And then the last one, again, we're doing all of what we've done before, but this time we're starting to look at the association with aesthetic treatments. So nerve damage can vary sort of with any injury. And for my assignment, this is a little bit from that, looked at the different levels of damage that can occur. So you've got neuropraxia, so that's your least severe, and it's basically where the myelin sheath, so again it might go back to your anatomy and physiology, so the myelin sheath, which is found round here around these sort of structures, has been damaged, but it's not been damaged really badly, and it will start a few hours after the treatment. I'm not even going to attempt to say the other names, but we're talking about this one. I think it's axon temenis, is the level after nepraxia, and it's where the myelin sheath is damaged and there's a loss of the axion section as well. So you've got sort of the axion terminal and sort of it started, the sheath has been damaged and the blue bit in the middle has also been damaged. It can regenerate, it can be a slow process, but it can regenerate. And then you've got your most serious type of injury, where it's the complete loss and the complete loss of the axion. You can't regenerate. If there's no cells there for mitosis to happen, it's completely severed and there is no regeneration that can occur. So again, nerve damage is a rare complication, but you do need to be aware of it within aesthetic practice. And it's important to know what are the steps I can take to prevent nerve damage in the first place, or if it does happen, what can I do to stimulate healing. So things that can be mentioned before, like electric toothbrush when people have had ptosis. Also, TENS machines are great for trying to stimulate healing within the nerves as well. So side effects that can happen with sort of the nerves being affected, being more specific to the face, is some of the common areas of injection. So you can think about if you're injecting botulinum toxin within the masseter muscle, if obviously we're working around the lips as well, the sort of mandibular nerve can be affected, and what can happen is you get then an asymmetric smile. So when your client smiles, it looks like it's drooping on one side, a bit like Bell's palsy or a stroke. And also they might have facial weakness and drops, which is artosis. So a way to avoid that is obviously not to inject too close to it. So again, sometimes our injection techniques might be more superficial than deep. And again, nerve injuries will take their time to heal. So it's about patience as well. So as a roundup, think about using Google Scholar to be able to get to the more aesthetic knowledge and the higher things. Do your own research, okay? Make sure you understand what you're researching and see the value of it, and then put it into your own words. There are examples online, but if everybody uses the same one and the same examples, then you'll all come across as at some point having plagiarism. So it's important to make sure that if you find a good resource online and you share it with something, or you find someone's shared it to you, just be wary and making sure that not everyone, if you know other people that are on the course, are all doing the same work.